More concerns over COVID spread as we grapple with one of the worst surges during the pandemic thus far. Hospitals are starting to fill back up with those COVID patients. Right now, nearly 3,100 people are in the hospital battling the virus. And this week, we saw the largest one-day rise in patients of the pandemic when counts rose by roughly 250 going from Sunday into Monday. We are nearly 80% of the way to our all-time hospitalizations peak, which was set last winter.
State leaders are yet again worried about hospital capacity as more people are admitted for COVID. WCNC Charlotte's Chloe Leshner is live at StarMed's testing and vaccine clinic on Tuckasegee Road. Chloe, what are their concerns?
Hey, Fred, they're concerned that some of these people will end up needing hospital care all at the same time. Take a look at this line here at the Tuckasegee Road location. It has been like this all day and every day for the past few weeks. They have not gotten a break. And right now in Mecklenburg County, more than 30% of the people getting tested are getting positive results. Healthcare workers are trying to stay afloat as a tsunami of new COVID cases is likely to land more people in the hospital.
A less severe virus that hits way more people is going to result in higher numbers of hospitalizations.
Omicron cases have already exceeded the number of cases we saw in the Delta surge, but in the Carolinas, hospitalizations haven't caught up yet.
Well, that's the only saving grace right now. If Omicron put people in the hospital like Delta did, the healthcare system would have collapsed in our country by now. So we're still pushing the boundaries of what hospitals can handle, and I think it's going to be like that for at least the month of January.
In North Carolina, 80% of all hospital beds and 85% of ICU beds are being used right now.
COVID pneumonia.
Experts worry that could quickly change. Atrium Health sharing its latest data. 68% of the people on life support are 18 to 64 years old. 97% of all COVID patients are unvaccinated.
Whatever we can do to slow down this tidal wave that's coming at us right now over the next couple of weeks is going to be important. We are not yet at the point of our height of COVID-related hospitalizations as we have hit in the past. Certainly concerning that we will hit that peak.
Both hospital systems making it clear they still can care for people who need it. They also do have the ability to add more beds. The challenge then becomes having enough staff to care for those people. A lot of healthcare workers also testing positive for COVID right now. Live in Charlotte, Chloe Leshner, WCNC Charlotte.
Yeah, those healthcare workers, part of the community, just like all of us. Chloe, thank you.